Hello, my name is Alan Kraft, and I am a social worker for the Kettering Health Behavioral Medicine Center Intensive Outpatient Programs. Today's video is about signs and symptoms of anxiety and some ways to manage anxiety. Everyone will occasionally experience feelings of nervousness and anxiousness. However, people who have been diagnosed with an anxiety disorder experience intense, excessive, and ongoing worry and fear about everyday situations. Oftentimes, these feelings increase to the point of interfering with the person's ability to carry out daily activities of home, school, and work. Let's take a moment to review some specific signs and symptoms of anxiety. Feeling nervous, restless, or tense. Having a sense of impending danger. Breathing rapidly. Sweating. Trembling or shaking. Difficulties with concentration. Avoid going places and interacting with others, racing thoughts, irritability, sleep disturbances, and increased heart rate. You will be pleased to know that anxiety is treatable with the support of therapy, medication, life changes, or a combination of all three. There are many different medication options that can assist in the management of your anxiety. It is important to know that medication is not a cure for anxiety and can't make it just go away. But it can provide you with a calming response that can make the management of the anxiety a little easier. Therapy can also become a very important part of treating anxiety. Some objectives of therapy in the treatment of anxiety may be being able to identify triggers, becoming more aware of how one's anxiety progresses from low to high, learning to identify negative thoughts and creating thoughts that are more helpful. Learning coping skills such as the use of relaxation, deep breathing, and imagery. Here are some other things that you can do to help manage anxiety. Create a routine. Create a routine around meals, bedtime, hobbies, and interactions with others so it takes away some of the uncertainty of when things are going to occur. Exercise. Engage in physical activity that is good for you, such as going to the gym, yoga, going on walks. If you have concerns about starting an exercise routine, please consult with your primary care physician. Eating healthy. There is no magic diet that is going to fix anxiety, but pay attention to how much sugary and processed foods and drinks you are consuming. Get enough sleep. Difficulties with sleep can be a sign of anxiety. It can be helpful to develop a routine around when you go to sleep and wake up. It can also be helpful to limit or remove the use of computers, television, and phone usage prior to going to bed. Allow yourself to have fun. Look for opportunities to do things you enjoy, whether it's with others or by yourself. Try something new. Don't worry about how long the fun lasts. Take whatever the moment gives you. Pay attention to your thoughts. Anxiety taints the way we think. Anxiety tends to lead us to focus on what we think is going to go wrong. When this happens, it can be helpful to think in a more reasonable way and even look for the positives that are still occurring. Avoid alcohol and drugs. Substance misuse is common in people who deal with anxiety. Although for some, it may provide a short-term moment of relief from the anxiety. Long-term, it can make the treatment of anxiety difficult and/or lead to other problems. It is important to remember that anxiety is treatable, but there is no quick fix. It will be important to be patient with yourself as you enter treatment. Keep your appointments with your treatment providers. Let your providers and your support system know how you are feeling and thinking. Practice, practice, practice. You will be learning new skills to help manage anxiety. Make sure that you are practicing these skills regularly. Lastly, give yourself time. I know you want to feel better now, but no one can determine how long it will take for that feel better moment to arrive. But by following these guidelines, that moment will arrive. If you continue to experience symptoms or begin to have suicidal thoughts, please go to your nearest emergency room or call 911 for assistance. We look forward to seeing you in group, Keep practicing your skills, and you got this.